who likes to talk about sleep? Such an important topic today. And I think as we have this conversation, we're going to be talking about sleep for adults, for those of us that are juggling many things and have tasks throughout the day, and we need to be rested and thinking clearly and well hydrated and hormonal vitality and all of that. But I also get the picture, Funke, that we'll talk a little bit potentially about how to help our children sleep as well. Is that right off the bat? Is that true that you work with both adults and children as the
Yes,
restful sleep MD?
yes, I do. I do.
Okay.
You are right on point because one way or the other, kids' sleep affects parents' sleep. So I work with both children and adults.
So good. So, for those of you listening, I have Dr. Funke Afolabi Brown, and she is a triple board certified sleep physician and the founder of Restful Sleep MD. She's also the best selling author of Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. So, for any of you who are struggling with sleep for yourself and or have children that are not sleeping through the night, we are going to get into that. So she helps individuals prioritize sleep, achieve optimal health, thrive, and live to their fullest potential. As a busy physician and mom of two, what are the ages of your kids, Funke?
16 and 13. I can't even believe it. They're both teenagers.
Okay. And are they sleeping through the night? At what age were
Oh,
they
yeah.
sleeping through the night?
Well, I mean, my story starts with them not sleeping through the night. That's why
Mhm.
I'm so passionate about this. So,
Mhm.
but navigated the first 2 years was a bit of a struggle. And then probably by the time they were around 15, my daughter did a lot better, but my son just didn't read any memo. He was just like, I don't know what you're talking about, but it's all about me. So
Yeah, I'm really looking forward to having this conversation today. And also, so cool that you're a consultant and a speaker on regional, national, and international platforms. And you've published several peer reviewed manuscripts on various sleep disorders. So, for those of you, she has her sleep medicine training at the University of Pennsylvania, and I'll make sure her contact information is down below. I think a nice place to start, Funke, is just to go, all right, you were already a physician. Is that right?
Mhm.
And then you became a mom. And I'm imagining your life turned upside down in some way related to sleep. Otherwise, you probably wouldn't have become so passionate about what it is that you're doing. Can you just tell us a little bit of that story and kind of that origin of what brought you to being so passionate about helping people with sleep?
Yeah, no, and you're right. I may potentially still have ended up doing this because I don't know. I feel like I was just born for this, but I feel like my own story and experience helps me connect in a different way with my clients, my patients, and even when I speak on stage. So I started off, high achieving woman who wanted to conquer the world and burnt the candle on both ends and got burnt out very quickly. And then fast forward, had my kids who didn't care about what baggage I was bringing in to the motherhood experience. And they were just like, we're just going to do whatever. And I thought, oh, okay, I'm a physician. I should have figured this stuff out. I tell people about these things, but I tell you, it doesn't necessarily mean that you have it easy, even though you have that expertise. So
Mm,
navigating, and I had loss around that time too. My father passed away. So struggling with grief, struggling with anxiety, struggling with addiction for performance. I was addicted to work in that sense. And then hormones with pregnancy, and then my kid coming up, and I just hit a wall. And so really had to navigate all of that through a lot of work on myself, setting boundaries, getting therapy, all of that. And then realizing that one thing that I knew that was very important to me, and this changes, everybody's different. For me, sleep, I'm super sensitive to poor sleep or sleep or sleep deprivation.
yeah.
And so that was something I just said, okay, you know what, this is something within my control. I could set boundaries and get more sleep. I could figure out how to get my kid more sleep and work on the insomnia and all the stuff that was going on. And it changed my life forever. And so after that,
Mm.
I said, oh, wait, there's so many people like me out here who are struggling, and it doesn't have to be the case. So that really got me inspired and motivated to start to talk more about sleep, to pursue a fellowship specifically in sleep medicine.
Mhm.
And then, down the road to actually live my daytime employed position to really make this, as I say, make sleep a thing.
Mm. I love the slip of the tongue. So you were going to say sleep deprivation, but you almost said sleep dehydration, which is
Mm,
so valid, right? Because dehydration causes lack of sleep and lack of sleep causes dehydration.
and I know. You kind of
Hmm.
shrink your sleep within this, like, okay, I only have this 5 or 6 hour window. And
Hmm.
so it's dry and shriveled, and it's not robust, and
Yeah.
just leaves you so exhausted the same way you
Yeah.
would feel when you're
Yeah.
dehydrated.
Right. And even the visual of a cell that's shriveled or
Yeah.
like a grape that's big and
Yes.
plump versus a raisin. Like we want to be grapes, not raisins.
Exactly. Exactly.
What are the consequences of either not enough sleep or poor sleep?
Yeah, no, it's I guess we'll start with dehydration.
Yeah.
And I think there are many aspects of our lives that's impacted when we don't sleep. First, I would say is I kind of work my way from top to bottom. There's no part of your body and your mind that kind of goes unscathed
Hmm.
when you don't get enough sleep. So even just our learning, our cognitive performance is one of the first things we see that starts to struggle. So that ability to make executive decisions, memory consolidation, all those things. And now we've seen that there's data showing that people who don't get good sleep over time are at risk of developing long-term memory issues like Alzheimer's, right? So that's a thing. And then the mood and mental health piece, I think, is very prevalent in both children and adults. So you have an irritable child who's inattentive and impulsive, and adults
Hmm.
have that version too, right? So you're more likely to be anxious, you're more likely to be depressed, you're more likely to be irritable, make poorer choices. Our teenagers take more risks when they don't sleep well. And then, just our general health. Heart health is a one thing that's been really studied so well to show that higher risk of hypertension, higher risk of abnormal heart rhythms, strokes can come from lack of sleep, poor sleep,
Hmm.
or not enough sleep. And then, our metabolism, more at risk for hormonal issues. So insulin changes can occur, leading to what we call impaired glucose tolerance, or eventually diabetes, obesity, because you have fluctuations and changes in your hormones, including hunger hormones. So you might not lose weight easy. And then just a high cortisol and stress overall. And then, things like, human performance at work. So teamwork, being able to achieve productivity declines when we don't sleep well. And so unfortunately also there's a higher risk of suicidality, um,
Hmm.
unfortunately, even with poor sleep. So it affects every single part of our bodies, every single
Yeah.
part of our lives when we don't sleep well.
Man, that's a laundry list. And I mean,
Mhm.
there's so many places that we can go from there. For those that are listening, definitely, if you love this episode, you might want to go back to episodes 55, 56, and 57. I did a deep dive into sleep, and I'm curious to kind of unpack some of that with the sleep expert here. There's a lot of people that will say, oh, yeah, I got 6 hours. And I hear that many say a minimum of 8. I'm curious if you have thoughts. What do you believe from the research that you've read regarding how much sleep do adults need and how much sleep do children need?
Yeah, I mean, usually the range is anywhere from 7 to 9. That's the general recommendation. But I think it varies so much with each individual. There are some people that are what we call genetically short sleepers, and there's
Hmm.
some who are long sleepers. So it's all, I think, about knowing who you are, knowing what your needs are, and listening to your body. So if you're someone who sleeps, 7 hours, and you wake up in the morning, you feel refreshed, you're not like binging on coffee, you're able to stay awake alert, and you're true to yourself, then maybe that's enough. But you might be someone who sleeps 8 hours and you're still, dragging, then maybe you need a little bit more. So I think that piece, and I always liken this to a pair of shoes, right? Like not everybody's gonna wear size 8, not everybody's gonna wear size 9. You gotta just find what will fit the best. And
Yeah.
the way you can figure that piece out is the general ballpark. And so just listening to your body and then just increasing it, 15, 10 minutes here and there, I think it'll make a difference.
Yeah. Well, and some might like Nikes and some might like Adidas and some, what is the Hokas? That's the latest. It's also how wide do you like your toe? Um,
Exactly.
as you support people, do you recommend that they wear aura rings and get into the science of REM sleep and deep REM sleep and into the nitty gritty there? What are your thoughts there?
Yeah, I mean, for a select group of patients that I see, not everybody. So there's some people who obsess over data and they get more anxious and they now
Mm.
develop insomnia. So for those, I just say I don't even want a clock in your room, right? Like, let's just sleep. That's all. But there's still some others who maybe they're high achieving, high performing, but they just want to like optimize, right? So I do help with optimizing sleep. So with athletes, with executives, and it kind of gives them that sense of accountability. And so we're making changes based on the data, but also listening to them. So I think I kind of look at it as a two-edged sword. For some people, it actually makes their sleep worse when they're constantly obsessing over data. But for some other people, again, depending on what kind of person you are, what you do, optimizing, like, oh my goodness, look at that. Let's see what the trends look like when we make X, Y, and Z changes. It
Mhm.
absolutely works.
What about the concept of sedation is not sleep? So I imagine I go in to see a physician and I'm going to expect that they'll
Mm.
likely prescribe me an Ambien, maybe suggest some melatonin, or I'll see people going, oh, yeah, I just have an extra glass of wine at night to take the edge off. And this
Mm.
concept of sedation is not sleep. Could you speak a little bit to that? Do you have thoughts on that one?
Yeah, no, that's such a great question. And I think it's just sad. Right now, people go to the doctor and say, I have a sleep issue, and they are expecting a pill.
Mhm.
But what we know about some of these medications is, yes, some of them can actually help insomnia, but they're only recommended for short term if there's
Mhm.
issues. So, for instance, I have someone who's truly had very severe insomnia, super anxious, really, really struggling, where I say, okay, maybe for a week or two, let's put you on this just to kind of stabilize things a little bit, at least make you get some version of sleep, and then we work on long term strategies. So, for long term, it's not recommended. For short term, in some specific situations, it's okay. But it is what you said, sedation, because it's not necessarily generating natural sleep. Some of that may change just the quality of sleep you get. And so many times I might find people who say, yeah, I get some sleep, but I still wake up feeling groggy because it's really causing some of that leftover daytime sleepiness. So it's definitely something to pay attention to.
And so what are some of like if you were to say, here's my top 3 things, people are saying light therapy or reduce your caffeine, increase your exercise, have your nighttime routine. Some say eat a banana before bed. I mean, I hear so many different things. Do you have your top 3? Like these are my tips and tricks up my sleeve that work pretty consistently with the majority of people that I work with.
Yeah, no, and you're right. There's so much out there. So I would say first and foremost, I would say is consistency.
Mm.
Because there are two things. If you look at it from how is sleep regulated? It's regulated by what we call our sleep drive, meaning that you build up sleep drive over the course of the day and then you feel sleepy at night. And then your
Mhm.
circadian rhythm is that internal clock that helps you to know it's bedtime and helps you to know when it's time to wake up. So if you can work on boosting those two systems, you will succeed. When I talk about consistency, that's really around helping to regulate your circadian rhythm. And some studies have shown now that when we look at the impact of what impact poor sleep has on health, it is more often the consistency piece than the quantity. So
Hmm.
if you can set a consistent wake up time and a consistent bedtime, it helps to reaffirm and just kind of resynchronize you with that internal clock to say, yes, this is morning. And so sleeping in on the weekends, being all over the place with your schedule is not ideal. So that consistency, I think, is a big deal.
Mhm.
And then, there's also sort of that, what we call the kind of cues. What are the cues? So this way you hear the lights, all sorts of things, just getting you ready for bed. To optimize those cues, there are a few things that you can do. It would be things like having that routine. And many
Mhm.
times for our kids, we talk about a routine. We read a book, we take a bath, we do all kinds of things. And then for ourselves, we just jump into bed. But your brain actually looks for cues to help realize that it's time to get into bed. So if you have a routine, that's a cue. So what does that look like? It may be taking a bath. listening to some podcast, and then maybe reading a book or journaling, and you get into bed. So I think having a routine is very, very important. Another one, so I'm kind of like, I have quite a number of favorites, but I'll say three. If you're going to say, okay, I need to pick three, I would say work on optimizing your sleep drive. What we mean by that is avoid doing non-sleep activities in bed. So sleep only in bed. And there's a few things that go under that. You might find out that you're someone who's constantly working in your bedroom, and so you're answering emails in bed, you're watching TV in bed, maybe you're eating a snack in bed, or you're becoming anxious in bed, the mind racing. So that still falls under that. So if you notice that you're doing non-sleep activities in bed, it's time to get out of bed, do it somewhere else, and when you're ready to sleep, get into bed. So you shouldn't be watching TV in bed. You shouldn't be watching TV in your bedroom. You shouldn't probably be drinking or eating or worrying or doing work in bed. You really want to keep the bed for sleep and intimacy. And you shouldn't be.
Oh, wait, I'm so glad I went because I was like, where's the other S word?
Yeah.
So at least, okay, good.
Yes,
So the
please.
intimacy S word gets to be in bed.
Yes, it gets to be in bed. That you get to do. And you could cuddle in bed, and all that is good. Then if you're noticing that you're like super anxious, super wired, tired but wired, and you're not able to sleep, that's a non-sleep activity. Worrying and stressing and being anxious is a non-sleep activity. It goes against, it's hard to fall asleep amidst a lot of mind drama. So in that kind of situation, you may want to get out of bed, do something calming and relaxing, and then return into bed once you start to feel sleepy again.
I often talk about the S's of sleep. We can have sleep and the S word that says intimacy. And then the S's that don't belong in the bedroom are screens and sedation. And so as you were talking, so first, the consistency, yes, yes, yes. And this concept of like social jet lag. When we don't have the consistency, we're literally we all know what it feels like to have jet lag and a time change. But we forget that when we're up really late one night and then another night, we're literally creating social jet lag for ourselves. So I'm so glad you brought that up. But then I also sounds like you're kind of touching on the adenosine conversation. This, the sleepiness buildup or pressure. I'm curious if you can speak to that concept of sleep debt and what is adenosine and how is this working and how do we optimize it?
Really, when you wake up in the morning, you have what we call a low sleep drive. Over the course of the day till evening, you have a buildup of that sleep drive in form of a substance called adenosine. So it's a product that's just, made like it's almost like a waste product that's, builds up, and then you go to sleep and then your brain sort of recalibrates and then you start again the next day. So there are a few things you can do. As that adenosine builds up, you can mask it with different things. You can mask it with a nap, right? If you take a nap, guess what? You're going to get a drop in that sleep drive. And so this is the issue where we talk about you want to try to avoid very long naps and you want to avoid late naps because you're going to get a drop in that sleep drive. Another thing that masks it is caffeine. So if you drink caffeine actually has it has this it blocks those adenosine receptors. Okay. And so it gives us, because adenosine build up in your brain makes you start to feel that sleepiness. So it gives it makes you feel not so sleepy when you have caffeine on board, which is why people don't fall asleep and they're in bed and sometimes their eyes are wide open or they're waking up frequently. Now, there are different people who metabolize caffeine differently, so it doesn't necessarily apply to everybody. But usually what we'll say is, if you're going to drink caffeine, maybe by 1 p.m., if you have a 10 p.m. bedtime time, maybe by 1 p.m. you stop because it has a very long half-life. So you want to make sure that you have it all out of your system before bedtime. So that's another thing. Another thing that can optimize your sleep drive is exercise and physical activity. So having a routine where you have physical activity during the day can improve your mood, improve your alertness, and actually build your sleep drive up. I usually recommend, though, don't exercise too close to bed, because sometimes just that physical activity will increase your heart rate, increase your core body temperature, and then it might make it hard for you to wind down to sleep.
So good. So wake up in the morning, get sunlight. If you're going to have caffeine, stop around 1 p.m. move our bodies. If it sounds like if you're going to take a nap, make it short. I'm assuming 20 minutes or less,
Exactly.
and do it in the earlier part of the day, not the afternoon.
Mm-hmm.
And really take seriously the concept of consistency. And we
Mm-hmm.
want to build up this sleep pressure. We want to build up
Yeah.
adenosine.
Yeah.
What about for the women that are in perimenopause
Mm-hmm.
and they're having hot flashes or that 2 to 4 a.m. wake up where their mind is buzzing, but their body's exhausted?
Mm-hmm.
And what has worked in their 20s and 30s
Mm-hmm.
all of a sudden is just thrown out the door. And maybe they've tried hormone replacement therapy, maybe they haven't. I'm curious if you have any tips or tricks for that specific population of women.
Yeah, so hormone replacement therapy works in, especially for that. Sometimes women wake up because they have hot flashes, and that makes it hard for them to, or night sweats that then kind of triggers that awakening. Sometimes it's the mind racing, and hormone replacement therapy has been shown to help. I think the issue is it's not all or none. It doesn't fix everything.
Mm-hmm.
So if you have a lot of anxiety, if you have stress build up, your body is so used to those repeated wake ups, it's important to look into treatment of insomnia. One of the things we talk about is cognitive behavioral therapy for insomnia. But even at best, you can start off with something very basic. You don't necessarily have to jump into CBTI unless you do know that you have insomnia or you've been struggling with this for a while. One of the things that works is what we call stimulus control. So remember, I told you mind racing, anxiety, stress, and trying hard to sleep is not a sleep related activity. It's not. So, what
Mm-hmm.
you want to do, I know you're tired, is just shift positions for a bit, especially if you've been awake for maybe like 20, 30 minutes. You're tossing, turning, you're stressing. Now you're looking at the clock, you're worrying, you're planning. Just get out of bed and just calm yourself down, relax, whatever that looks like for you. Might be reading a book, journaling, and maybe doing some breathing exercises, listening to a podcast. There are many different things that you can do to help you to unwind while you're waiting for sleep, and then sleep comes and then you fall back asleep. So I think that's
Mm-hmm.
really important. Another thing is really look through the day. Are there activities that I'm doing that may potentially contribute to my nighttime waking? So basic, are we drinking caffeine? Are we drinking alcohol? Do we have spicy meals on board? Are we physically active? So you want to not forget all those basic things. And then finally, women around that perimenopause, menopause have a higher risk or higher incidence of obstructive sleep apnea. So this might be obstructive sleep apnea, in which case, especially if you're waking up, either repeatedly or you're waking up, your mouth feels dry, you kind of feel just kind of out of it. It might be that your brain is waking you up because you're not breathing well at night. And in
Mm-hmm.
that situation, you should get checked. You should get evaluated for obstructive sleep apnea.
I interviewed Dr. Tanner, he's a dentist that talks about the position of the jaw and its relationship with sleep apnea.
Mm-hmm.
So let's say someone is listening and they go, "Wow, I've tried all those things. Yes, I'm using hormone replacement therapy. Totally honor that we need to get away from the band-aid approach, right?
Mm-hmm.
It's not just another pill, but what else is going on? Cognitive behavioral therapy, potentially assessing sleep apnea. When does someone decide to go find a sleep specialist like you? And how is it different to work with someone like you versus going and seeing their primary care provider or a therapist? Can you talk through that a bit?
Yeah, absolutely. So for someone like myself who is a sleep specialist, I'm looking at this holistically. So I'm looking
Mhm.
at medical things. So you might need all members of the team, and I work very collaboratively with a lot of patients and their providers and all of that. So what would differentiate me from you just seeing your PCP is the thought that your age, and also the different things that could be going on with your sleep. Unfortunately, most PCPs maybe have 15, 20 minutes with you. So it's the pill, right? It's like, oh, this pill didn't work. Ambien didn't work. Let's try trazodone. Ooh, trazodone did work. Let's try mirtazapine. Oh, okay,
Yeah.
But for me, before we go into medications, we're saying, what are we missing? Where lack of sleep is a symptom of something. That's it.
Hmm.
So it's not a condition, it's a symptom that is pointing towards something. So what's
Hmm.
it pointing towards? For women in menopause, it might be pointing towards different things. It might be pointing towards hormones. It might be pointing towards something almost like psychological. It might be pointing towards habits, revenge, bedtime, procrastination, whatever, you're drinking alcohol, all of that. and it might be pointing towards sleep apnea or other medical issues. Restless leg syndrome is another one. Um, and so we're kind of looking at it at all these fronts. It might be pointing towards iron deficiency and restless leg syndrome, right? So that evaluation becomes more holistic versus
Mhm.
just take this so that I'll see you back in 3 months, right?
Yeah.
So I think that's important. But I mean, on earth, oh, wow, this is really mainly driven by anxiety. Or now things have been so complicated because you've struggled for so long. Now you've developed anxiety. Okay, we need to work with your therapist. But I don't know that your therapist will be able to order a sleep study, order blood work, or, and
Yeah.
not every therapist is familiar with cognitive behavioral therapy specific for insomnia. So it becomes
Mhm.
more of a kind of, you're looking at this from a 360 lens. So in
Mhm.
terms of who should go when, I would say when you've tried the basic things, if you've talked to your doctor and you're not getting the answers you want, don't just hope it will go away. Reach out for help. And at the end of the day, you may reach out, it may be a book you read, it may be something you find online, but really do start to ask yourself, where is this coming from? And can we get to the root cause of it?
Mhm. And we have listeners from all over the world that listen to the Women's Vibrancy Code podcast, and maybe you're wherever you found this. Funke, are you seeing people virtually that are all over geography, or how do they find someone that's going to be able to work with them regardless of where they live?
Yes, yes. So various ways. So I have a clinical practice. So in terms of my clinical practice, I'm licensed in California, in Pennsylvania, and in New Jersey. And then I have a couple more coming up. If you go to my website, you'll find out that information.
Yeah.
So if you had a purely medical issue, then I'll be more than happy to see patients, and I see patients virtually or in person. I also have a coaching program. So this really is more for, again, executives or high achieving women, but I see, female professionals, I see moms, I see anybody. And I just kind of help support you to kind of look at this holistically. I may, depending on what state you're in, I may not be able to prescribe, but then I guide you to like, okay, this is what you need to do. This is how you can advocate
Mhm.
for yourself. This is what you need to maybe sometimes tell your doctor, or
Yeah.
these are a list of sleep doctors that can potentially help you in that specific region. Because I've been fortunate enough to work, across so many states and with so many sleep experts around the US and all that. And then there's a website. You can actually go to the website. It's a very clunky, but you can navigate that. So it's called the American Academy of Sleep Medicine.org. So AASM.org website.
Mhm.
And they have a section there where you can actually look for a sleep provider in
Mm.
your area.
Okay. But it sounds like you do have courses, you have a book, and you also do your own you have your own YouTube channel where there's a lot of resources out there. If someone wants to find your YouTube channel or find you on LinkedIn or Instagram, what do they search for?
Yeah, so you could search for Restful Sleep MD.
Okay.
So Restful Sleep MD, my YouTube channel, my Facebook, Instagram. I'm Dr. Funke Afolabi Brown on LinkedIn because they have you have your professional name there. So
Yeah.
yeah, and then my YouTube, I think my YouTube is a great resource to start. I put it all out there because I cannot see everybody. I would love to, but I can't.
Yeah.
But I do put information that's useful. It's not fluff. It's not just sleep hygiene is important, but we go beyond that. And
Mhm.
so when you can actually find disease specific conditions, information on menopause and all kind of things there. And I also interview so many professionals there too. So I'm looking forward to having you as well,
Yeah, I'm looking
Mariah.
forward to it
So,
too.
you really get that kind of holistic view of sleep, because at the end of the day, when I do my own, if I do a solo episode, it's all sleep. But usually if I'm working with someone else, we're talking about something, maybe a different thing that connects to why you're having a hard time sleeping. So I might have someone who has issues with setting boundaries, or someone who has issues with menopause symptoms, and is trying to
Yeah.
explore different, holistic treatment strategies, which will potentially improve their sleep. So that's definitely a great place to
So good.
explore for more information.
Yeah, so good. I have another question, and I'm not exactly sure how to ask it yet, but I'm going to find the right words. Because when you're talking about a holistic approach, we talked about off camera, you're Nigerian. I don't know how much of your life you spent in Nigeria versus here, but I am aware that there's this American culture that feels like pressure, feels like go, go, do, never enough. Um, you know, live in order to work versus
Mm.
work in order to live. From your upbringing, your life experience, do you think that there are cultural undertones where it's more pronounced in some cultures than others, where we are just burning the candle at both ends, and in that being part of the lack of sleep?
Yeah, that's 100% the case. And
Mm,
especially here in the US, in westernized countries, I mean, even in Nigeria, where you have more of the professionals, more of the high achievers, people are sleeping for 4 hours or less. It's
mm,
crazy. And it's more of until I get there. And we know the concept of arrival fallacy, right? You feel like, okay, if I do this, if I just get to this level, if I just get this amount of money, if I just get this promotion, and you never achieve it. So it's this constant, endless search for it. And that is really one of the main reasons why we have a nation that is completely burnt out and is exhausted and sleep deprived.
yeah.
CDC declared that sleep deprivation or insufficient sleep is an epidemic. So that's the thing. So that piece, that issue of um, exhaustion being a badge of honor, I think
Mm,
that really, really, really is one issue that a lot of advanced or westernized countries or communities struggle with as a source. And sometimes we also, I mean, as high achieving women, we define ourselves by our performance, right? Our productivity, and that concept of, sleep is for suckers, I'll sleep when I'm dead. I
right.
think it's getting better now. There's just this awareness around wellness, and people are looking for more natural ways to heal themselves from the inside out. And so sleep is,
Mhm.
as one of my friends says, sleep is having a moment. So it's getting, there's a little bit of a shift, but we still have such a long way to go.
It's so good. Right before we started this, I was at a workshop and I had to race home and get here on time, but it was um there was a part of it that they were talking about the concept of home. Like when I'm home in
Mm,
my presence, what does that feel like? It feels like peace, it feels like rest, it feels like presence, it feels like connection. And that difference between I am home versus oh yeah, I got to go home.
mm,
And I'm just realizing how much of this conversation is relevant to that. What if
mm,
we define success by how much time we spend at home, meaning
mm,
like defining our success by how present we are and how connected we feel and how rested we are. And, I was a midwife for 17 years attending
mm,
births. And that moment when the baby's head comes out and takes its first breath, time stands still.
mm,
And I've been able to be privy a few times to be there midwifing individuals as they took their last breath
mm,
and to look at like when time stood still, what were the pieces that were most important?
mm.
And to go, right, this quest for sleep, even that sometimes has got to check the box. A calorie counted and the time of the screen time versus just going, wow, where can we move back to redefining how we even define success and where we find presence and how we celebrate our ability to rest.
Mm,
um I really applaud that it sounds like you're really looking at this concept of sleep from a much more holistic
mm.
perspective, so thank you.
Oh, thank you. No, you hit it right on the head.
Mhm.
And Ariana Huffington said this. She said exhaustion is a sign of chaos. It's not a badge of honor. And you just feel so dysregulated. And there's
Mhm.
so much. For me, I'm a woman of faith too. So when I look at the fact that everything is working for you, and not against you, and this constant rush, sometimes when you slow down and embrace the presence and express gratitude for where you are, what you've achieved, it takes the pressure off. Whew,
Mhm.
my goodness, we're up to here. And sometimes we miss that. We miss the moments that we're meant to just embrace, and coming to the place of rest, stillness, sleep as a form of rest, I think is the ultimate way to say, okay, I'm just going to trust that
Yeah.
everything is working for me.
Yeah, that surrender and trust is so valiant.
Mm,
Before, when we were off camera, I mentioned Lavia Jai Jones. I love
mm,
this, the Nigerian troublemaker. She wrote Professional Troublemaker, and one of her quotes from that book, I use it so often. She said, "Stop asking people for directions to places that they haven't been."
mm,
And so, how often do we struggle with sleep and we go into the provider that has 15 minutes and we leave with another prescription, not really being taken seriously? And so, for those of you listening, like, hear this, you have resources, you can really feel heard and acknowledged as a complex and holistic, amazing, complex being that you are. And sleep is not as simple as just popping another pill.
mm.
Anything else that you want to add? We didn't talk about children in sleep. We didn't talk about sleep chronotype and that concept of like night owl versus morning lark. But anything that feels unsaid, anything you want to add?
Oh, I mean, I think this is a beautiful way to end. I mean, I think there's so many layers to this,
Hmm.
but I think we're on the right track when you come to understand why this is important and not just something you check off your to-do list, but this is time when, you go to bed, you have no idea within those 8 hours what's happening. It is a miracle every single night. So you get the privilege to partake of that miracle. Your brain is being repaired and restored. Your immune system is being regulated. Your metabolism is being reset. Like there's so much going on. So let's start from that. Let's start from prioritizing it, starting to pay a little bit more attention, and then reach out for help to figure out how do I fix this? Because there's help available for you.
And it's also when the majority of our testosterone is produced.
Yes,
So
exactly.
for those of you that want muscle tone and energy and
Ex-
libido, like, we need
It's all
sleep.
there. It's all
I
there.
love, I did when I was a member with Masterclass, I forget his name. Is that
Matthew
at UC
Walker.
Berkeley? Yeah, Dr. Walker. And he was saying, guess what percentage of people can actually exist on 6 hours of sleep a night or less? Zero. I'm like, what? That's
Yeah.
substantial. If for those of
Mhm.
you listening, if you think, I mean, I guess there are some that are genetically predisposed to be
Yeah,
able to handle less, but for the
sure.
majority,
It's very rare that genetic predisposition. So most people say, "Oh, maybe I'm a genetically short sleeper." Not, nope, nope, nope. It's a very, very tiny percentage. So, and
yeah,
you'll see it if you go on vacation, and you can tell your blood pressure's off. You're more irritable. You're taking that extra cup of coffee. You're
yeah,
snipping at the kids. You
yeah.
need a little bit more.
You're putting on weight, your hormones are out of whack, your immune system's off, you're getting sick more
Yeah.
often, all of it. Okay. Thank you so much for everything that you do. I'm excited to swap, and we'll do this again, and I'll be on your platform. And for those of you listening, I'll make sure all of her contact information is in the show notes. Buy her book, follow her, and maybe her course is the right fit for you. But Funke, thank you again for your time. And it looks like you're in the clinic, so you probably have to go back to seeing some patients.
Thank
And
you so much for
yeah,
having me.
of course, I appreciate you and the work that you're doing. It's important work.